One of the critical problems and the most urgent one is that we have all of these children without quality frontline care. And so that was cascading into a whole slew of other global health problems, and starting even with maternal health, even before that. And so the idea was, why were community health workers, such an important line of defense against these longer term problems?
Well, I think what we know in the healthcare system is that we're organized in such a way that doctors and nurses do the primary amount of diagnosing and prescribing medicines, right? So we're concentrated in cities. So let's take my country. 51 doctors were left after the Civil War to serve a country of 51. 51 doctors to serve a country of 4 million people. So that'd be like the city of San Francisco having just 8 doctors. So you can imagine trying to provide health care in the city. You might get a chance if you get sick there, but if you're out in rural areas, you might take days to get to the nearest clinic. So these community health workers, importantly, they have to be part of the medical team. They work with those doctors and nurses to bring health care to regions where most family doctors would never go. So they're out in canoes. I was just out there a few weeks ago out on motorbikes with them. They're out in forest communities, and they're treating children for malaria. They're helping mothers ensure they have a birth plan and can get to the clinic to deliver, and they're being coached by nurses in these communities. So they're critical in the settings that we're working in. The challenge is there's not enough of them, and most of them don't get paid.
So we created a roadmap essentially out of this effort. And I see Nathan here at Insigniam as part of this effort. We created a roadmap to identify the critical needs. So there are 4 different areas, which I'd love you to be able to talk about, and then see how do we achieve all this. But the most fundamental part of this roadmap is that it lays out a case for a return on investment.
Yeah.
So I want you to talk a little bit about why that's so important.
Sure. Well, we know there's 400 million people across the world without any access to healthcare, even the most basic of health services. We know that employing, hiring, training, and equipping a community health worker in those communities, extending the reach of the primary healthcare system, can bring healthcare to those people. And we know they can save lives. So the return on investment is when you get more lives saved. In parts where we're working, a quarter of children's death has dropped by providing malaria, pneumonia, and diarrhea treatment and malnutrition care. The second thing that happens is it's good for business, right? I mean, healthier life years, we've shown in numerous studies that you will have more productive workforces, whether it's the 5 million or so employees you have collectively, or it's your suppliers that are actually benefiting from the productive life years. The third thing is reducing risk. We saw that during Ebola. Bill Gates has talked about the fact that if we saw a pandemic in the world, it could lead to up to $6 trillion of economic loss. It costs $3,000 to employ a community health worker, equip them, and train them. And as you said, they were one important piece of helping stop the Ebola epidemic in its tracks during the crisis.